In one of our recent videos, we talked about a breast reduction surgery, and we contrasted that a little bit with breast lift surgery. Today we're going to focus on the recovery from a breast reduction or breast lift really, and what the expectations are like for the first several months. So as I mentioned in the original video, when I send patients home, they're wrapped up in a tensor bandage that holds everything in position. It also allows you not to worry about anything for those first few days. You can just relax and slowly get back to normal routine. You'll come back and see us at 3 days' time, and we'll take that bandage off and put you into a comfortable sports bra. I would say it's about the first week that you're slowly getting back into your normal routine. You're not doing anything strenuous, but you are moving around. There's no specific restrictions in terms of movement of the arms or light things that you can do, but you're certainly not going to do anything that's going to really increase your blood pressure or strain you in any way. By the time we take the bandage off, put you into the bra, and you've gotten to the first week after surgery, now you're really back to all of your daily routine. You're probably back to driving. You're likely back to work if your work isn't too strenuous. And at this point, at 1 week, your restrictions are really just no exercise or heavy lifting or anything that's really high strain. And you're also going to be wearing the recovery bra or a good sports bra continuously day and night. Those restrictions, those last for an additional 3 weeks. So now you're at the 4-week mark, and you can wear whatever kind of bra you want. You don't need to wear a special bra, and you can start to go back to the gym and to regular sports and exercise. My follow-up is usually at that 4-week mark, and that's when we can identify anything that may be taking a little bit longer to heal, which may change those instructions. But generally, right after we see you at the 3 or 4 day mark, that's when you're back to your normal daily activities, and then at a month you're back to full activities, including sports and exercise. In terms of the results, obviously with a breast reduction, this is a big change. You'll notice right away. In fact, when you wake up from surgery, you'll feel that weight off your chest, quite literally. And then over the next few days, things will start to settle into position. I would say we're about 60 to 70% to our final result at that 1 month mark. And then it's really a question of letting everything settle into a natural position and allowing the scars to mature. And the scars are certainly the last thing to really fade away. And for that, I tell patients we're anywhere from 3 months, where we're about 80% of the way there, to about a year or even a little bit more than a year for the scars to mature. During that period of time, you should be back to your normal life, doing everything that you did before without any restrictions. But of course, you will follow a hopefully detailed scar regimen, and that's tailored to each individual patient, and we follow how that scar heals and adapt as necessary. But other than scar management, nothing to do after that 1 month mark. So that's a little bit about breast reduction recovery and expectations for that initial period. We'll talk about risks of breast reduction in our next video. Stay tuned.